I really, really need to talk about the CDC stuff. CDC reversing its language on its website about potential airborne transmission of COVID. Many of you guys today, when I was at work seeing patients, were like, hey, Dr. Jen, have you seen this? Are you going to comment about it? Like, what do you think? What's going on? So yeah, I definitely had to comment about it. And so for those of you who are not familiar, those who are not familiar, basically the CDC updated its language on its website a few days ago. And basically, according to CNN, I'm looking at CNN to see what it used to say. There was language to the effect saying that there is growing evidence that droplets and airborne particles can remain suspended in the air and be breathed in by others and travel distances beyond 6 feet. And it went on to, I guess, to talk about the importance of not having indoor environments without good ventilation, et cetera. In other words, it was sort of acknowledging airborne transmission and ways to stay safe and kind of ways to sort of navigate this. Now, we know that there has been a question about airborne transmission for a long time. And in many scientists and doctors' eyes, there has not been a question about airborne transmission. There are many people who think that airborne transmission is very likely a component. I think so too. I definitely think that airborne transmission may be a component of what we're seeing. And many scientists have actually called for a changing of the way we think about COVID to reflect what may be some airborne transmission. Anyway, initially, when this was posted, I saw on Twitter very early this morning before I got to work, a lot of doctors saying, yay, finally the CDC is recognizing airborne transmission. It's about time. Now we can get to the business of put in proper precautions and do what we need to do to stay safe. Awesome. Then all of a sudden I'm at work today seeing patients and I'm seeing that the CDC has reversed its stance. Now, guys, this is concerning to me. You know that I am a fan of the CDC and the World Health Organization. I am a fan of, bodies and organizations and groups that are for science and that collectively help determine what is good science, what guidelines should be, help us sort of, I'm a fan of all that, okay? You know I'm a fan. I'm always quoting the CDC and the World Health Organization. But me being such a believer, I'm now starting to get frustrated. And you know that if I'm getting frustrated about this, it's like something's going on. Well, first of all, I should tell you what the CDC's response was when they were asked about why that language I just read was taken down. A spokesperson for the CDC told CNN, they said a draft version of proposed changes to these recommendations was posted in error to the agency's official website. CDC is currently updating its recommendations regarding airborne transmission of SARS-CoV-2. That's the virus that causes COVID-19. But once this process has been completed, the updated language will be posted. So in other words, what happened was they went back to the other sort of prior language that had been on the website, really not acknowledging the airborne transmission, okay? So it reverted back to the prior language that the CDC had, and that's what the CDC spokesperson said in response to that, saying, "Oh, this was a mistake. This was posted prematurely. This happened too soon. We weren't done with the language. Somebody, in fact, there's a quote saying somebody hit the button and shouldn't have, like posted the language." So now, the CDC page says now that COVID-19 is thought to be spread mainly between people in close contact, about 6 feet, and through respiratory droplets produced when an infected person coughs, sneezes, or talks. This is the same language that the CDC had on the website that's been posted for months. This is the language that I've often talked about. We think COVID is primarily spread through the transmission of upper respiratory droplets when we cough, sneeze, yada, yada, within 6 feet. This is why we wear face masks and do all that stuff. But as you all know, I'm saying this again, there has been question and suggestion that there's some airborne transmission, and many of us think that some component of airborne transmission very, very likely may be playing a role. Okay, let me get to my point. If I haven't already, I'm disappointed. I'm so disappointed, and I could talk about the airborne transmission thing. That's a whole topic in and of itself. Okay. Is it airborne? Is it not? Why isn't it? Why is it? Why are we saying this? Why are we not saying this? Okay, but let's put that aside. What I want to talk about and what I'm disappointed in right now, as someone who is a firm, faithful believer and follower of the CDC and the World Health Organization, I'm disappointed at these continual backtracks and changes. I I'm not going to say I'm starting to lose faith because it's going to take a lot for me to lose faith, but I tell you what, I'm getting frustrated. And I know that these backtracks and these changes and these oops, just joking, or oops, didn't mean that, or oops, psych, like that stuff doesn't help us at all. And I know that it's making you all skeptical. My mom just said to me tonight, she's like, yeah, I don't know about the CDC. Now they keep changing things. Are they telling me the truth or not? Now, if my mom starts saying that, we know we in trouble, okay? Because she follows the CDC faithfully, probably because I do. I'm really, really disappointed and I'm concerned about the message it sends the public. We're supposed to be better than this, better than the sort of oopsie daisy, somebody hit the send button. We're supposed to be better than that. We're supposed to be beyond that. And I don't remember this ever really happening like this before. Now, maybe we haven't followed the CDC site so closely. Maybe, in my lifetime, I don't remember there being, well, actually, no, because when I was going on the news talking about Zika and Ebola, no, I would read the CDC site literally every single day for updates because that's how this information is transmitted and transferred, right? That's how we get a lot of our information. But I'm disappointed, and I think that this is going to cause a lot of you, my patients, our consumers, fellow Americans, to lose faith. And that's the last thing we need in this environment where so many of us have so little faith already. I'm not sure, and I'm wondering, is this a we know better so we're doing better situation? I'm not sure about these last couple times. This doesn't feel like we know better so we're doing better. These seem like mistakes or errors or something fishy going on. And I'm not a conspiracy theorist, but it does bring up this question of what's going on. Is there political pressure, which I know is not a unique or novel thought that I'm having. Everyone on the news has been saying it today, though I haven't watched the news because I haven't been home to watch it. But I know that people are saying, is there political pressure behind it? It's a reasonable thought, right? Is there something else going on? What's happening at the CDC? Is there disorganization there? Like, is there something going on within the CDC that we don't know? And I'm not trying to plant a seed of doubt in your mind. I'm just expressing my concerns with this organization that I still do believe in. I'm telling you, I haven't lost faith in the CDC. I'm still going to quote the CDC. But I'm making it publicly known that I'm having a difficult time with all of these backtracks. Especially since these last few times, it doesn't seem to be a situation of we know better, so we're doing better. This is, oh, somebody hit the send button too quick. What? Y'all, the CDC, what you mean somebody hit the send button too soon? What you mean? So, I'm disappointed. And I'm frustrated. And we're literally in the middle of a pandemic. That's hard enough. That's bad enough. Life is tough enough right now. I saw teachers today that are in schools that are literally crying tears of anxiety and sadness and fear because they don't have enough protective equipment and they don't feel like they can take care of their students and they're worried about bringing it home. I've got parents that are worried about their kids being in school. I've got people who have lost jobs. We all do. It's not just me. I have patients who've lost their jobs because of the downturn of the economy because of COVID. I've got patients who have lost family members due to COVID. I have physician colleagues who have gotten really ill with COVID and had major complications. I know physicians who have died from COVID. And this is all of us. This is all of us. This is not just me, it's all of you. You all know those same people too. You know people who are teachers, parents, who have lost their jobs, who have died from COVID, who have been sick with, you know these people too. So COVID is hard enough. What we don't need is this back and forth. And I'm going to put this out there. I'm going to ask the CDC. I don't know anyone at the CDC right now, but I'm just throwing this out there. Anyone at the CDC who's listening and looking, please hear us. We need consistency. And we need to feel like we can believe and have faith. And it's not that we can't. I'm not telling you to not believe and have faith in the CDC. I'm telling you to have. I still have faith. And I have faith in the World Health Organization. What I'm saying, though, is that these backtracks contribute to a loss of faith. And I need it to be gotten together. You know, I say this as though I have some impact on that. I'm just disappointed. And it makes it harder for me every time I come and tell you guys, hey, wear your mask. Hey, da, da, da. I know you guys are like, yeah, right. They're going to change that next week. And why wouldn't you? Why wouldn't you? It makes our job harder as doctors. It makes our job harder as civilians and people in this world trying to get through COVID. So I'm sorry to kind of go on a rant. I kind of had to get that off my chest, apparently. And I also want to talk with you about what you're seeing and what you're hearing. I don't think there's any doctor that's crazy about this. And I know that you're not crazy about it either. I am still going to hold out hope, though, and keep the faith that the CDC and the World Health Organization has us in their best interest. I'm still going to do that because I do believe in science and I do believe in the sanctity of those organizations. I am going to need them to get it together. And I wish that they would and be more consistent. So I'm going to keep coming to you with information about this stuff as it goes on. We're going to hang in there. We're going to get through this. I just don't want you all to lose faith, because when people lose faith, they stop doing what needs to be done. I should have said that before. When we lose faith, we stop putting credence into wearing masks, da-da-da, and da-da-da. And we know those things work. But the CDC flip-flops, it may give some people this idea that, oh, nobody knows what's going on anyway. Wearing a mask is not going to matter. I bet it doesn't even matter, right? You can see how some people may go there. And that just sets us back. So I'm not going to keep harping. I'm going to ask you to wear your mask and to do the right thing and to social distance. All right, guys, I'm going to head out. I love you guys as always. You're my peeps. Thank you so much for watching, and let's stay the course. And even though we have little bumps in the road, you know what? Those bumps, we're gonna get bumps or this way. these are ditches. Even though we have little bumps in the road, we are going to get through this. So let's hang in there, wear our masks, do all this stuff, guys. I love you. Hang in there, and thanks always for following along. I will post more content tomorrow. Okay. Good night.